Learn, which is about developing age-friendly communities between Birmingham and Leipzig. My name is Heather Law, and I'm the International Affairs Manager responsible for the Leipzig-Birmingham Partner City relationship, along with Manuela Blum from Leipzig. I'm also delighted to be chairing the session today. So next slide, please. So just some practical points. So before we get going this afternoon, I'd like to draw your attention to the slide on the screen. And the first thing to do is to make sure that you have the correct language setting. So you can do this by going to the bottom of the screen, and there will be a globe there. If you click on the globe, you can select either English, if you're English, or German, if you're German, and that will give you access to the correct translation. Please could you mute your microphone, but it'd be great to see you, so please switch on your camera. A message for the speakers and interpreters: please could you scale your volume up? And then just to let everybody know, at the end of the session, there will be a question and answer opportunity. So please put your questions into the chat, and also note who that question is addressed to. Next slide, please. One thing that you'll notice is that each of the slides is divided into an English side on the left and a German slide on the right. So this hopefully won't be confusing for you. Just in terms of the timetable, we have to keep strictly to time. So when speakers have 2 minutes left of their allotted slot, I will raise my hand, and that will alert you to the fact that you need to wrap up. We'll have opening remarks from Dr. Martina Munch and Councillor Pocock. Following that, at 12:40, there will be Stefan Eckner speaking about the village for the elderly. And at 1 o'clock, there will be commemorational events. And we've got an input both from Birmingham and Leipzig, followed by home visits and senior citizen visiting. And that will be from Leipzig. And last but not least, there'll be an intervention from Della from Birmingham Public Health on early intervention. So without further ado, I'm going to hand over to Dr. Martina Munch, who's the Deputy Mayor for Social Affairs, Health and Diversity. And Dr. Munch will then be followed by Councillor Rob Pocock, who is the Councillor for Transformation, Governance and HR, and is the former Cabinet Member for Health and Social Care. So, Dr. Martina Munch.
Thank you so much, and a very warm welcome from the city of Leipzig. Can you hear me, Manuela? Hello?
I can hear you.
Oh, that sounds very good, because unfortunately I didn't find the globe on my screen, and that's why I'm not so sure. I'm supposed to speak German, but for me it's not a problem if it's in English. But I think we organized it that I talk in German and that you get a translation. Is that so?
That's correct, yes.
That's correct, thank you. Okay, so thank you very much. I have to apologize that I can't attend the meeting very long because I'm in the middle of the negotiations for the new treaty for the government of Saxonia, and that was unexpected, and that's why I only have a very short time slot, but I would like to welcome you all very warmly. So I continue in German and I hope everything is fine now. Liebe Kolleginnen
Deutsch.
und Kollegen aus Birmingham.
Dear colleagues from Birmingham and dear colleagues from Leipzig Council and dear guests, it's a great pleasure to welcome you today to our virtual exchange between Leipzig and Birmingham. Since 1992, our cities have had a very close relationship, which have blossomed and deepened in many areas, which is particularly in social and health issues. And it's been a long-standing cooperation, and it shows our shared commitment to improve quality of life for our citizens. Today's session is about important issues such as well-being of our older generation. Programs such as Village for the Elderly in Leipzig aims to support dementia patients in their day-to-day activities so they can continue to participate in life, and memorial services for the deceased who die without relatives. So it shows that we can care about dignity and humanity. And another topic is home visit programs that enable older people to stay at home and receive support through personal contact. And I understand, and I'm pleased to hear, that there are similar initiatives in Birmingham to address the challenges of aging. Our cities are not just linked by social cohesion, but there is also a rich history as industrial hubs. Leipzig and Birmingham have always reinvented themselves after times of change and are now cultural and economic centers. Also, there's a musical link. Leipzig through Johann Sebastian Bach and Birmingham through influential rock and heavy metal bands. I'm absolutely sure that our exchange will prove and provide valuable input that both cities will benefit from. And thank you very much, and I look forward to the discussions, and all the best from Leipzig. Thank you very much.
Thank you, Dr. Munch. And passing over to Councillor Rob Pocock.
Well, thank you, everyone, for attending this event. I'm just checking that you can also hear me.
Yes.
That's great. It's an honor to be given this opportunity to be part of the opening of this event. Dr. Munch, I was delighted you mentioned heavy metal from Birmingham. We are very proud of our metal manufacturing industries in the 18th and 19th century. This reputation is carried forward with heavy metal. And to mark a historic event for those of us getting on in years, the band ELO, Electric Light Orchestra, have announced their final celebratory concert in Birmingham next summer. So I would invite anyone from the Leipzig delegation, please come and join a celebration of a great band.
Yes, we'd love to. Thank you.
Our city. It's an honor to be here also to discuss work on developing age-centric, age-friendly communities. I speak as a cabinet member in Birmingham who arrived on our council late in his life. I became a councillor at the age of 60 on this council and a cabinet member at the age of 70. So I probably am the oldest cabinet member this council has had for a long while. So I'm personally committed to the ambition of both of our cities developing age-friendly communities. We are also honoured again to have this opportunity to discuss these opportunities internationally. It's a matter of regret for many of us that with Brexit, those opportunities are fewer. But we're grateful, obviously, to the funding support here, and the German people have helped to continue this dialogue, which has proved so productive for all of us. We do have a number of lessons we have learnt from our colleagues in Leipzig, so I'm grateful for all the opportunity we've had to learn from another city. We're hoping to adapt the work we do here to pick up on that learning. Two particular initiatives I'm keen to support in this collaborative venture. One is the work we do with carers. As people age, they rely on others. They rely on their partners, husbands, wives, partners. They rely on family and friends as informal carers. And having a carers strategy has been one of our important priorities for this city, to make a contribution to an age-friendly community. And we've just literally, within the recent weeks, passed a new strategy, a carers strategy across our city, which recognises both formal carers in the care system and also particularly the value of informal carers, often unnoticed, often unsupported, often incredibly central key to the support they provide to older people. And I think a component within an age-friendly city that is often missed. Secondly, we picked up a thread which relates to those who are aging without children. We have a project
Thema aufgenommen der Personen, die ohne Kinder älter werden. Wir haben
AWOC, aging without children, is an important issue for those who are aging and where they have not family or younger people to come and help and support them through their later years. So a further step we hope to take to recognise particular difficulties faced by those who age without children and families close to hand is an important gap that we also are trying to fill. But in conclusion, like you, Dr. Munch, I can only stay here a short while. We have our own budget to be set in this city. We also have, as we speak, I believe, our own Chancellor of the Exchequer announcing a UK budget, which was of considerable significance to local authorities because we are dependent increasingly on government support and have had a dwindling level of that government support in recent years. So we are optimistic that the tide may be turning here, but I await the outcome of the national budget announcements here today. And then in our city, we have to make some very difficult decisions on balancing our own budget. So my apologies, as with yourself, Dr. Bunch, that I won't be able to continue through the rest of this session today. But I do wish all participants all success in this venture. I think it's a real tribute to both of our cities that we've managed to do so much work together against difficult circumstances. And I look forward to the progress, which I'm sure we're going to make over the weeks and months to come. Thank you very much.
Councillor Pocock, and thank you, Dr. Munch. And moving now on to our first presentation, and that is by Stefan Eckner, who is the CEO of Municipal Nursing Homes in the Leipzig Village for the Elderly.
Ja, vielen Dank.
Thank you so much, and hello to everybody. I was presented, so I would like to get into my presentation at once. In short words, the presentation. So the Altenheime in Leipzig, the establishments in the Leipzig municipal area, we are a municipal subsidiary. We have 10 full-time inpatient care placements in the city of Leipzig. And you see it here on this image, which is equally distributed, our establishments and operational parts. So we have 1,323 full-time inpatient care placements, as already said, in the 10 establishments. And going beyond this, we have 41 part-time inpatient care placements. And in one establishment in the center of the city of Leipzig. We have 30 intensive care placements, 6 housing projects for senior citizens, and great outpatient services, physiotherapy practice, occupational therapy, and podology practice.
Allgemein, insgesamt Personal.
Basically, as far as the staffing level is concerned, we have 1,284 employees, trainees in the company for many years, which have been employed. Our turnover in 2023 was approximately 70 million, 71 million, with a profit of approximately 595,000 euro and 121 million in the balance sheet, just to be very roughly here, as far as the dimensions of the companies are concerned. So in Germany, we are organized in different federal states. So we are also Federal Association of Local Authority Institutions for Senior Citizen People. I'm the second chairman. We are also in the Federal Association of Local Authority in Saxony, where I am head of the association, and also in the health and care network in the city of Leipzig and in the senior citizen sector of the city of Leipzig. And let's get to the topic of the presentation, Village for the Elderly. A basic approach is that this project was initiated some years ago, and it's a special form of a very specific care of dementia patient, and going beyond this also supplements as far as the offer of full-time patient care placements are concerned, coupled with age-appropriate assisted living options, and the entire package under the prerequisite of a comprehensive care with own services like kitchen, laundrette, and other services which might be needed in such an establishment. The site, if you focus on the city of Leipzig, we could see on the map that we are equally distributed in the city of Leipzig, and the new site is located in the north of Leipzig, but within the municipal area where you see the cross.
Ja, hier mal ein paar kleine Eindrücke.
These are
das
some
Grundstück habe ich vor
impressions about the site.
2 Jahren
So 2 years ago, I
20.000
purchased this site. There's a 20,000 square meter of space with existing buildings, and in addition to these existing buildings, we have very beautiful trees on the site, and it's like a park, a huge park. And currently you see on the right picture, just if I go back here, so in the meantime, we made it, we refurbished it, we redeveloped it a little bit, and we placed a fence around the building, so it will take a while until 2025 probably. And this is the present planning status, which is depicted here. And here we have a site with existing building, as I said, and on the right side and on the left-hand side, you see the existing buildings, which should be maintained and redeveloped and restructured. These are the 4 buildings you see on this picture with supported apartments, so age-appropriate flats and apartments with services which can be booked on additionally to the normal services with these gray surfaces or rooftops. So these buildings are the new buildings, and the fully
Betreuung bzw. Pflege untergebracht sein wird.
time inpatient care is being performed here, and also the dementia care for the special patients is also located here. So this is just a depiction of how it's described as far as the usage distribution is concerned. For the new buildings, there will be a basement So it's partly equipped with a basement. Two wings with these connection building are completely restructured and developed with a basement to have the ancillary services like laundrette, the kitchen sector, and for the both houses, the changing cabinets and changing rooms, warehouses for stocks will be built in these areas and sectors. And on the first floor, where you see this PB, these are the caring sectors in both buildings. In the floor, in the ground floor, people with dementia will be accommodated here. And per wing, we have 12 rooms with patients, and these three wings are connected with each other so that in the ground floor, 36 inhabitants or patients live in the dementia-focused area, and on the top floor, there will be a full-time inpatient care, and in the other building, as far as the concept is concerned, for younger persons, for younger patients who need care below 65, and we will bring them together because we have quite a few of them in the company, and there is no possibility of accommodation for the insurance, for the health insurance, and there will be separate homes for these patients. And I would try to have these 36 square meter residential units with these groups of patients to accommodate people appropriately and have another caring situation for the patients. So these 4 yellow houses originally are the existing houses, which will be turned into apartments, so age-appropriate living. And in the center area, you can see it also on another image. There will be a common services room, a meeting room, a cafeteria, to get together with different usage options for the patients in order to round the entire situation off. So you have on this image the connection in the ground floor, in the basement, in the ground floor. We plan for the new buildings to connect them with the basement pathway, to use subterraneous connection and the remote supply. And in one sector is the laundrette, and in the other building is the kitchen. So the supply, the electric supply is guaranteed by these basement pathways, and the elevators and the cafeteria of these meeting rooms, of these center part is also connected to these facilities, to the supply facilities, so that supply is guaranteed.
Ja, nächste Seite. Hier sieht man mal ein bisschen
So here you
modelliert,
see
wie das
in a model
aussehen wird.
how it will look
Also in der
like
normalen Darstellung, nicht in der
in a
Draufsicht,
normal
sondern in der
image, not in a bird's perspective, but in a dimensional image with the view towards the village square. So the new buildings basically are 2-floor buildings, and the old buildings are 2-floor buildings with the roof level, the roof floor. And here the depiction where you see the trees, the existing trees, these green circles are the existing trees on the side. So we also have trees which are over 100 years old. So you basically see that in the center part where the cafeteria is located, that in the outside facilities, the village square will be located. So the entry part from the right side, in the center part, this red line of the existing buildings, and the management and administrative unit will be located in this part, in this sector, and the entrance part, the entrance unit, and then you can get directly into the garden directly to these new buildings, to these most new buildings, and in the ground floor, the residential areas for the dementia patients. They are basically open. The 22,000 square meters will be fenced, but in the side everything is open. So each patient in this dementia sector has access or a balcony door to the outside facilities and can freely move on the side. And by these planned ways and connections, you see this clearly on the next image, how it will look like. So this is just a view towards the care sector, to the village square. It's a little bit systematically depicted here because we are just drafting it. And but the presentation was prepared 2-3 weeks ago, and there are new images and new pictures where it's easier to see how it will look like in the future. But you get the impression here that different rooftop forms and shapes are used, flat roofs, greening on the roofs, and to provide a certain flexible character to the installations. And the next picture, you see the residential buildings, how they are integrated in the outdoor facilities by means of these complexity of connection ways and pathways. There won't be any ways or pathways which will end at some point. Everything will be transitional, and the central point is built by the village square. And these 4 trees, they are really old trees and huge and tall trees. So this is the central focus, and we will see how we will design it from the outside perspective. So different topics and themes for gardening and greenery, banks, seating options, to dwell, to go for walk, will be planned and integrated, and also the caring situation. This outdoor facility should be integrated.
Ja, das ist die Darstellung des
So this is the plan for the center part, for the 3 residential groups, how the units are connected, and you see the entrance situation, the entrance area
vom Untergeschoss aus sieht,
of the ground floor or of the basement. So how the rooms for these basement sector, how they are described, how they are connected, how they are designed.
Das wäre dann in dem zweiten Haus,
And this is the second building. We are still planning this, deliberating of the location of the kitchen. It has something to do with the accesses, with the supply and disposal of materials. If we have 2 accesses to the premises, or if we do it only for one building, we are still planning this, and there's some coordination with the construction authorities and with the city of Leipzig. Some coordination negotiations are taking place here, how to plan and design it for the basement, so the changing rooms, the sanitary facilities, and the yellow part on top. I think it's the laundrette, and in the other image, the kitchen. So this is still in a certain flexible status and can be modified. So this is the ground floor area. This is a little bit smaller, and you see the basic principle of the entire complex. These 3 wings with correspondingly 12 rooms. These are all single rooms with a size of approximately 15 square meters, plus the bathroom. So each room has a bathroom and is completely equipped. And the aim is, in this gray center part, correspondingly, we have the living groups, the kitchens, the eating, the dinner rooms, and on the opposite side, the living room section, and correspondingly on both sides. So the dining and the kitchen section and the living segment, to have it as a common room, which is separated by certain design construction. So you have a big terrace which can be used. You can go outside, maybe on the one side or the other side of the building. And in the center part between these three wings are the caring units, the service rooms, the wear rooms, the deposits for wheelchairs, for electric airchairs, for charging, lifters, lifting equipment, all these different instruments and material which is needed for the staff, and the caring bathroom, which is also accommodated in the center part. And we could see the image where we showed different shapes and types of roofs. And we see clearly here that the staircase section on the right side, which is a little bit distinctive here, it's like a small tower which we use to get to the roof, to have access to the roof as an entrance area, to have a central entrance element. And part of this central area will be a normal tiled roof system, and the caring units will be accommodated in the roof section with greening, with gardening, so that by means of the materials and the shape of the roof, the impression arises of a house character, of a village character. So we will work with different materials, so that we aim to use the existing buildings, and having a plastering facade for these building elements, and the new construction, we use wooden and timber material.
So, dann sieht man hier mal, wie das dann im ersten Obergeschoss
So here you
aussieht.
clearly see how it looks like on the first floor. It's quite an identical situation, with the difference that you do not see the entrance from the front, that you have a closed system. So the entities, the room entities have been slightly modified. Team consultancy, service consultancy elements and units are included, and these elements are quite identical to the first floor, but with the difference that we have a downstairs and terrace, and on the top we have balconies. So there's a rooftop, and we are planning for this rooftop. It is planned to use the option to install a roof garden, which can also be used by the residents. The lift goes upstairs to the roof, so we are just planning this to create it with our timber elements. We consider it for statical reasons, or from statical viewpoints. It is not a completely fixed target, but it's our wish to realize this rooftop garden. So this is a living room, a living group, how it is arranged and designed, the individual rooms with the corresponding exits to the pathway, to the corridor which leads to the meeting room. And these are not long corridors, these are quite short distances to get into the collective, into the meeting area. And on top, you see that the kitchen has been integrated and drafted, and with the stools, with the chairs, the tables, the dining facilities, the big glass facade on the terrace to the top, and to downstairs you see the living room with the huge terrace outside facility. And we are planning these details, that we have a terrace with small warehouse where corresponding furniture can be installed without carrying them through the entire building, so that it is quite functional in the planning stage, and with quite a lot of details, because it's not the typical situation housing situation for the elderly. It's a little bit different. And you see the
sorry to interrupt you, Stefan. We're running out of time. Could I ask you just to wrap up in the next minute or so? Thank you.
Das kriegen wir hin. Wir müssen eigentlich fast zu Ende sein.
Yes, I think I can manage. I'm close to the end of my presentation anyway. So I have explained this. This is the center part with the individual stores and warehouses and the service sectors. I was showing this in the other areas. And this is the roof terrace, the rooftop garden with some pergolas, with the greening, and that there is a certain quality of life to use this on top of the building. And this is a description of the two variants of rooms. The type of rooms, so we have barrier-free rooms. They are a little bit bigger than the normal caring rooms, and the bathroom is a little bit bigger. The dimensions are quite a little bit different here, so the design is different with a door to the outside, and on the ground floor with a terrace door for the people with dementia. And
Ja, das wäre nochmal dargestellt, der Eingangsbereich.
So this is the entrance segment with the administrative area where you have direct access to the building. It's not so important. These are quite normal office rooms. And this is the meeting area with the cafeteria, which has a huge terrace to the courtyard. You see, we are planning this huge gray zone in the center can be opened or can be segmented with walls which can be shifted and separating walls it can be used in different ways, sports of people, cafeteria, music sessions, different usage options. And for the cafeteria you need a warehouse, of course. So this is centered and integrated very, very beautifully in the on the premises and the buildings. This is the scheme with the stairways, with the stairs, and it's quite a normal residential house. It doesn't need explanation, I suppose. And this is an image of the layouts of the flats. These are flats with 45 to 50 square meters. And due to the structure of the residential houses, they have quite the same layout and the same section here. And I think I'm on time and I kept my time schedule. Thank you very much for your attention.
And thank you, Stefan, for sharing those wonderful plans for your very green village. I can see that there are a couple of questions coming into the chat, which is great, but we'll have time to answer those at the end of the session today. So moving on, we've now got a session about commemorational events, and it's my great pleasure to welcome two speakers, Sandra Dietrich from the Leipzig Office for Urban Parks and Water Authority, and Edward Roberts from Birmingham's Public Health.
Vielen Dank.
Many thanks. I'm going to start straight away so that I'm not going to go over time. To start off with, I'm really pleased about your interest, and I'm glad that you've started and that you've started with the first event, and I'm really excited to see what happens. So not just because it's our duty that our human dignity is guaranteed by German Constitution, it's our responsibility to be with those who died without relatives. And we're doing this by commemoration, by events on the cemetery in the east of the city. There is a separate room for those who couldn't come to the actual burial, or people, friends of the family, or anybody who would like to attend. I think you'll be far more interested how we do it, and that's how we do it. So Leipzig is organizing it together with the ecumenical group, and there's a network around it, so we don't have just two partners, but we incorporate two networks so we can absolutely start properly. So active citizens, those who have an interest in being there and for various reasons. And of course, the city council, the parliamentary groups, and so on. Funeral partners and those friends and family of the deceased. So that's how we do it. To start off with, there's a preparation, there's a debrief, and it starts about a month before the actual event. We just have a chat with those who are the organizers. What have we learned? What are we going to do? What are we going to improve? What's the weather going to be like? Because that's the question that will always be asked every year, because we can do it inside or outside. So obviously we have to do a certain amount of PR to get the tents organized, the chairs, the landscaping. And I'd also like to point out that we have a memorial book. It's the second page at the bottom here. So all of the names that we have read out, they will be incorporated in that book. So currently we have 7 pages. Next year there'll be 7. So the flyer here, I've just watched. We will be putting the flyer from 2024 for next year. So those who are attending will be taking a flyer for the following year. So that's something that's been developed over the years. And I'd also like to... How does it work out? How does it work? That's if you just come to the cemetery, you'll be accompanied by a trombone choir. You sit down. If the weather's good, we'll sit down outside. Otherwise, it'll be in the chapel. And then there'll be a City of Leipzig representative who will welcome guests. We light a candle, and that candle stays lit. And again, there'll be an introduction. It's not always the same stakeholder. There's not everybody will be doing their own thing. It's an event for everybody, and everybody can participate. And then we will be reading out the names of the deceased. We'll read out 10 people's names, then we'll have musical accompaniment, and the next 10 people, next 10 names will be read out. And experience has told us that we'll read out a woman will read out the first 10 names, then a man will read out the next 10. So that's proven to be quite good. And then we'll open the invitation to everybody to read out and to say the name of somebody, even though that person may not be on the list or may not have been mentioned before. Then together we walk to the burial ground. Before we obviously were in the chapel, and then we walk to the burial ground, and the candle will be carried to the burial ground. When we get there, the trombone choir will be there and will accompany us just to wait till everybody's there. And then we'll have a minute of silence. And then if people want, they can say the Lord's Prayer. And you can have the opportunity to scatter flowers or petals. And if you are looking for a particular burial ground, again, people will be there, cemetery staff will be there to show you where it is. I'd like to show you a little video of what that looks like.
Also, Sie sehen, draußen
As you can see, it's nicest outside. I hope you can hear the bird song. It was a great atmosphere. And to underline the dignity of the whole event, I hope I didn't go through it too quickly, but please do ask questions. I'd love to. And I think if that is the case, because then our exchange will be great, because it lives from that exchange. Thank you ever so much.
So now it's my turn to present. My name's Edward Roberts, and I'm working for Birmingham City Council and the Public Health Group. And we also run a similar event based off of the one in Leipzig. So as you can see, we got our idea from Leipzig and their event. And the way we went about it was we created a draft plan of what we thought might work. And this was basically an event split into two parts. The first part was having a lot of the kind of support organizations in the city, those that function around kind of death, dying, grief, and bereavement, to be present at the event, so that people that came or people that visited the church, we hosted our event in a church on a Saturday, they will be able to interact with those organizations and learn more about the kind of support that they could potentially access. And then the second part of the event was the memorial section. Now, I engaged with the Compassion City Steering Group and also other organizations and different people to get feedback on that kind of draft plan. And some of the larger kind of changes that we made to it was we added a choir, so we added music to the event. We added a homelessness section, and we made it more of a kind of a celebration versus a solemn event. Next slide, please. Next slide, please. Thank you. So the aim of our event was to remember people who had used a public health funeral. And a public health funeral is a funeral that is done for people within the city that are unable to afford or not in a position to pay for and organize their own funeral. Whether that is because they have no relatives or that they died alone, there can be different reasons for that. And one of the things that we did was we took some example stories of these people. And we wanted to say, where were they born? What did they do in their life? As in, what job did they work? Who were they? What do they like? What do they enjoy? And why was it that they ended up using a public health funeral? And that why question at the end was the thing that joined all of our stories together. It was that kind of common thread. So we have stories on public health funerals, and we also had stories on Finders International. Now, Finders International, and their flag is in the center of this slide, they are an organization of genealogists who basically track down people as part of their work. And public health funerals as basically has a commission with this group so that when they have somebody that dies in the city and they can't find relatives, they go to Finders International and they say, can you help us find family of this individual, to let them know they've passed away and to help us process the situation. One second. Can you go back up again, please? Okay. Yeah, thank you. And then we also wanted to raise awareness to the public of the systems as well as all of the support organizations within the city and to allow networking to occur within those organizations. Okay, next slide, please. So this is our venue. It's a church in Birmingham, St. Martin's Church. It is extremely central, so very accessible within the city centre. We were initially somewhat hesitant about placing it within a church because Birmingham has many different faiths. So having it in within a kind of Christian church could have been seen as problematic. But I discussed this with the Council of Faiths, and they assured me that St. Martin's Church is used by many kind of denominations, and therefore was a very acceptable place to have this. And the location was really fantastic. It's a very central spot, and on a Saturday, at least, it has fairly high footfall. So next slide, please. So this is basically a list of the different organizations that we had at our event. I won't read them out. It's essentially here to demonstrate the kinds of organizations that we worked with and the kind of support that we were aiming to not provide, but to raise awareness of within our events. And this event itself sat within what we have in Birmingham is Dying Matters Week, which is run by Brumyodo. And Brumyodo is an organization that has been working in this space for quite some time. And the YODO, the YODO, stands for You Only Die Once. And they organize a whole series of events at different parts of the city. We were trying to incorporate our event into their calendar of events. Next slide, please. Thank you. So promotion, we did this through mailing lists. We had promotion on Facebook and in newsletters, and we also had a radio slot. And we specifically asked those organizations that were going to be there on the day if they could also promote this event to their mailing list, to the people that use their services, to try and raise a profile of the event. We set those organizations up on both sides of the church. The church had quite a large space, which was excellent. And we ran our event from 11 in the morning till 4 in the afternoon, with the latter 2 hours being the remembrance part of the event. Next slide, please. So footfall was about 650 people in total, which is actually quite low for a Saturday. Normally you'd expect about 800 people, but we ran it on the very first nice day of the year. So possibly that was the reason why. For many of those people, unfortunately for our event, the church was the attraction. The church is a very kind of a tourist spot within the city. It's a beautiful church. However, some people did engage with the stalls and with the artists within the event. But the live cafe that we tried to run during the afternoon, during the lunchtime session, was very poorly attended. And what we found with live cafes and with death cafes is if you don't have a pre-existing group, quite frequently attendance at those events are very low. In fact, I was talking to one of my colleagues at Marie Curie Hospice, and they've literally had people come to a death cafe to tell the people running it how inappropriate it is. So the very term death cafe can be somewhat problematic, and it can be seen in quite a poor light. So it's something that generally we found works better with existing groups. And in a remembrance event, unfortunately, we didn't have that many members of the public stay for that section either. Next slide, please. So, as I've said, the remembrance event had public health funerals and finance international talking. We also had an introduction from Emma Hodges, who works with Compassionate Cities UK, and we had a lady called Glenys Caswell, who's a sociologist reacher in a kind of area of death and dying, and she presented a talk on this that actually was very similar in some of the respects to the work that Chris Whitty, who's our chief medical officer, did on this subject. So it was really nice. And then we had music and stories as well. For the number of stories and the amount of music, some of us thought was kind of obscured some of those public health impacts. However, some people also really, really enjoyed the music and the stories. And for them, that was a really big draw. So there was a bit of a division there. And the presentations went down really well. Next slide, please. So we had some evaluations. These are some basic points from the evaluations. When it came to engagement, the stalls had the highest engagement, followed by the artists, followed by the remembrance event, and then finally the Life Cafe had very few. Heather, do you want to jump in?
Sorry, that's just to remind you that you've got a couple of minutes left, Edward. Thank you.
Fantastic. Thank you. We thought a few people who responded to us thought that undertakers, wills and power of attorney and more arts and films would be good. Communication was rated quite low. The stalls were rated quite high. The footfall was rated quite low. Generally, the people that were there from the support organizations didn't engage with that many people. So that was unfortunate. And the remembrance section was rated quite highly. Next slide, please. And this is the last slide that basically are some comments that I just copy and pasted from those kinds of evaluation forms. So great events, an important issue. Hopefully attendance can be built up for subsequent events. Talks and performances were excellent. Shorter program with a bigger hook. There was nothing outside to let people know the event was on. Big error. Having an event with both a drop-in and performance element doesn't necessarily work for the subject. Many people may drop in and leave before any of the performances, so miss out on lots of the content, and then please roll it out again. And I think that's my last slide.
Thank you, Edward. That was a wonderful insight from both you and Sandra into commemorational events. So now I'd like to invite Andreas Paul to switch on his microphone, and Andreas is going to tell us about home visits and senior citizen visiting services. And just a reminder to everybody to put your questions into the chat and note who is asked to respond to those questions. So thank you, Andreas.
Ja, gerne. Danke für die Einladung.
Thank you very much for the invitation. And I know some of you. So last year we saw ourselves on the spot in the venue. I'm working in the Office for Social Welfare. My name is Andreas Paul. We are responsible for the visiting situation and the senior citizens visiting organizations. So it's a cost-free, City of Leipzig, cost-free of charge, and I've been existing since 1995 in this office as an initiative by the Senior Citizen Advisory Council, and the goals, they have not basically changed. So the topic is to counteract loneliness. So this has been a big topic 30 years ago, and people were focusing on older people who are lonely, and so we would like to go beyond this with further systems, further advanced systems where we see that help is necessary. This will be mediated in the structures which we have available in our city and in our office, and of course the offers and quotations we make as a city of Leipzig, we want to supplement and complete these offerings.
Genau. Der Seniorenbesuchsdienst wird im
The senior citizen visiting service is carried out voluntarily, so the people involved as visitors,
sind Ehrenamtliche.
they are voluntary people. The coordination and allocation by the social services, mediation is done by the social office, by the Office for Social Welfare. This is one office, and the minimum requirement for the voluntaries. So we defined 2 visits per month, sometimes more, sometimes less. So people see them each other more regularly on. But this is a network which we have planned. This is the interval we have planned. The appointments are tailored to the individual. We see the volunteers. They are registering, and then we try to mediate and organize their visitings. The people who want to be visited and the one who visit, they get into contact and they agree the deadlines and appointments. And we are not interfering as coordinators, and possible activities.
Ganz grundlegend einfach Gespräche, also
Just
tatsächlich dieses
Miteinander reden, the talking with each other is the most important thing of the visiting. Going for walks, dwelling around, cultural events. So there's no caring or household situation or housework situation, but there are other aspects depending on financing, and we are making a difference here, and we want to be part of this segment.
Natürlich wollen wir den Ehrenamtlichen auch was bieten.
Of course, we want to offer something to the volunteers. The exchange with the elderly is definitely a value added, and also we offer trainings, special events. you can see this on the picture in the center, so that events are arranged together with the volunteers. We invited the participants on a ship, and we're going on a trip on the water, and also to make visible our engagement. So there's an allowance of 13 euro per visited person. So one voluntary can visit up to 3 persons, and the 30 euro per month, they are a result of, it was agreed some year ago, tickets for public transport, and theoretically you could go there and back with the money. So this should be increased, and we are working on this. So currently we are at 122 persons which were visited between 55 and 97 years. 99 volunteers. So this is just the age structure, which we are trying to define a little bit more here. And we managed during the last 2 years to integrate more younger people into the visiting of older people. And on the other end, sometimes problems are involved because the helpers, the visitors, they get older themselves, and sometimes you need to consider if they are not part of the group, maybe, who wants to be visited. But there is, of course, constant exchange with the coordinators. And we have 4,828 visiting hours 2023. They are not resulting from the 2 visits per month, but they are also more visits which are performed without being paid for.
Die Hausbesuche, auch das ist ein
The home visits,
Kostenfreies Angebot der
this
Stadt
is also
Leipzig.
a
Das
cost-free
gibt es seit
offer of the city of
2020
Leipzig. It has been
und Schick
existing
wiederholt sich, auch das ist eine
since
Initiative
2020,
gewesen vom
and this also was an
City-Baurat.
initiative of the Senior Citizen Advisory
War zunächst ein
Council.
Modellprojekt,
First
was
of all,
wir
it was
bei
a model
freien Trägern
project, and
durchgeführt
for
haben.
free
Wenn
institutions,
Sie das
this
jetzt so
was
sehen,
carried out.
sehen Sie
And
auch,
if
dass
you
wir
see
während
this,
Corona
you
gestartet
can also
sind.
see that we
Das war
started during Corona,
ein Zugehen
and
des Angebots
it was
im
quite
eigenen Haushalt
an
während der schwierigen
increasing
Zeit.
offer in
Wir
the
haben es trotzdem
own
geschafft, das
in our own budget, and we
2023
managed
zu
in
verstetigen
2023
und
to confirm this, to
2023 ist
consolidate
eben
this.
eine volle
And
Stelle im
since
Sozialamt.
2023, it's
Auch
one
hier die Ziele
full
sind
position
Einsamkeit vorbeugen,
in the Office for Social
Selbstständigkeit
Welfare.
erhalten,
So
Risiken
the targets
vermeiden,
are prevent,
Minderheiten
avoid
unterstützen,
risks, healthy risks, loneliness
Schwerpunkte
of the
sind
elderly, and
Freizeit
the
und
main
Freizeit
focus
und
are
Pflege
on
und
freedom,
Gesundheit.
time,
Das
health,
variiert
and
individuell,
caring
also
situation of
müssen nicht
older
immer
people.
alle 4
This is
Schwerpunkte
varying
tatsächlich
individually.
auch
Not all
abgehakt
main
werden. Das ist aber
emphasis need to be
durchaus der
fulfilled.
Fall. Aber
However,
je nachdem, wie dann die
of course,
individuellen
one
Bedarfe sind,
tries to
können die
cover as
können die
many
Zeiten, die da
aspects
investiert
as
werden,
possible,
durchaus
and the
ein
time which is invested
bisschen
is
variieren.
worthwhile and can vary a little bit.
Genau.
Yes.
Können wir auf die nächste Folie? Danke. Zugangsweg. Das ist
Access,
auch tatsächlich ein schwieriges Thema,
definitely it's
weil
a
ist nicht
delicate
so ganz
topic
einfach. Also
because
wir
it was
geben
not
über
so
ein
easy. We
Gratulationsschreiben vom
have a
Hamburger Bürgermeister
congratulation
zum
letter of the Lord
75.
Mayor.
Geburtstag.
It's the 75th
Das
birthday,
heißt, die Menschen, die
which is an
im Stadtraum
occasion,
Leipzig
and the
75
people living
werden,
in the
kriegen
centers
relativ
and who
zeitnah
are 70 years old,
zu ihrem
75 years
Geburtstag ein
old, they
Anschreiben,
get a
also eine
letter
Gratulation vom
sent
Oberbürgermeister.
by the Lord
Und
Mayor
wir
and
gehen so vor,
congratulated
dass
in
in
this
dem
letter.
Brief kein
And
Termin
we
genannt wird.
don't
Das
mention
ist
any
tatsächlich
appointment in
ein
this
großes
letter.
Thema.
This is a big
Also die
topic
Hausbesuche
because
gibt es in vielen
the
Kommunen
visitings, the
mittlerweile
home
in
visitings
Deutschland.
exist in many
Viele Kommunen
municipalities in
machen das so,
Germany.
dass wir
Many
es mit Termin
municipalities say
machen und die
do it with an
Rückmeldungsquoten sind
appointment, and the
wesentlich
feedback
spektakulärer als
are
unsere.
quite more
Ähm,
spectacular than
Wir haben auch
ours.
gesagt,
And
mit dem Datenschutz ist
we
das
said, oh, the
die
data
bessere
protection situation,
Variante,
it's
wenn wir
the
den
better
Leuten das quasi nicht
variant,
aufzwingen, sondern
not
sagen,
to
melden Sie
force
sich bei uns
people
bei Interesse.
to say, okay,
Dazu
register
kommt
here if you are
Öffentlichkeitsarbeit,
interested.
also die
Then there's a
Standard
public relation
Abläufe,
work. These
Flyer
are the
und
standard tasks
Infoveranstaltungen.
and
Also wir sind
responsibilities,
tatsächlich auch
flyers,
als
homework,
Sachgebiet dazu
homepage,
vorgegangen, dass wir
informative events. So as
unsere
experts,
Dinge,
we
die wir anbieten, nicht nur den
try
Hausbesuch, sondern auch
to
viele andere
not
Sachen
to
letztlich
integrate only the home visits,
präsenter
but
machen
also
im
to make this
Stadtraum,
more
eben uns
present, to
präsenter
raise awareness, to become more present, and to offer more events so that we show what the city of Leipzig can offer. The figures in 2023, there were approximately 3,300 letters and 166 counseling sessions resulted from this, and only 109 using this letter with a feedback of 3.3%. So if you do it in a smaller municipality where everybody knows each other, the feedback rates are different. If you do it with an appointment, it's something different. But I would like to say that we are now using this one office position. This is our claim. We have been doing this for quite a time, and we see how it will develop as far as the 75 interval situation is concerned of the people. So the implementation takes 1.5 hours with some additional meetings. It's not used. Interpreters are an additional feature here. We bring something like, for example, an emergency tin. This is a plastic device for sanitarian usage with all these gadgets here, like carrier bags, bottle openers. Good advice for the elderly. So there's also like a manual, a domestic with all the offers for the city of Leipzig. I see that I'm running out of time, so I need to speed up a little bit. So the counseling is in the house, in the home, and this is the crucial part of it. We want to see how are the conditions at home of the people, at the homes of the people, and we would like to use the barrier-free reconstruction. It's possible to address us in the Office for Social Welfare during Corona. This was more crucial even, of course. But in the meantime, there is a national exchange which has been initiated by Leipzig in a digital way. And this year, there was a specialist day in Leipzig, present in presence, and it's organized by a national office. It's coordinated correspondingly. And by means of these two projects, we are on a good way, I suppose.
Dankeschön.
Thank you.
Thank you, Andreas, for that wonderful insight into home visits. I'd now like to invite Della Bailey from Public Health Birmingham, who's going to tell us about early intervention and prevention. And just a reminder as well to keep those questions coming in the chat. Thank you.
Can I just apologise on behalf of Della? She seems to have dropped off the call. Sorry, it's Grace Nelly speaking. But if you put up the slides, I'm happy to run through them for you.
Oh, thank you, Grayson. That's fantastic.
I know we're running out of time, so I'll condense it.
We've got 10 minutes, so that's absolutely fine.
Okay.
Could you put the slides up, please, Manuela?
Yes, something went wrong with my computer. 1 second, please.
It hasn't come up yet. Okay. I'm just going to give you a quick overview of our early intervention community team, which is, sorry, let me start again. My name's Grace Nellis, and I'm a team manager for the multidisciplinary adults team. And Della is also a team manager for the EICT, which is our early intervention community team. Now, the early intervention community team have been in existence for 6 years now. And this is a team, a system of teams that work within the community in a multidisciplinary approach. The team consists of a variety of professionals, like the district nurse, OTs, social workers, occupational therapists, and our aim is to avoid our citizens remaining in hospital as unnecessarily. So once somebody is admitted into hospital, we look to discharge, get that person discharged back home as quickly as possible, same day. If we're able to do it on the same day, then that's what we will aim for. Could I have the next slide, please? As I mentioned before, the model of the EICT is a strengths-based approach. Its framework is around being able to offer within our universal area assets and resources within the community. Over the last 6-7 years, what our department has been doing is working with our commissioners to develop assets and resources within the community that would enable our citizens to approach from a different angle rather than dependent on social care and health to provide the resources. We've developed a range of resources within the community so citizens can attend drop-ins or surgeries in order to identify the needs that they have. So there's 3 layers, like I was saying, that our universal model is about offering resources within the community so that our citizens don't become dependent on us. The targeted approach is where we're not planning long term, but a citizen's is taken on and will probably worked with one of the professionals and also resources from within the community, but it's over a shorter period of time because again, our main aim is to get people dependent back into the community. If somebody is deemed to require our specialist services, then this is where there is a statutory duty to complete an assessment of needs and eligibility for the citizen. But our main aim is to keep our universal model available for our citizens. So again, people ain't coming back into our system. Could I have the next slide, please? Collaboration. Our collaborations, like I mentioned, the team is made up of a multidisciplinary team. And in order, by working in this multidisciplinary way, the professionals are able to learn off each other and more able to offer the citizen a worker that is able to meet their needs. So, for instance, if there is more of a social worker's input needed or approach needed, then that person would be the more suitable person to work with our citizens. So each case is looked at differently, and each professional is identified to work with a citizen according to their needs. Could I have the next slide, please? Okay. Just looking at our next step. Yeah, again, our next steps are to develop our model and integrate it more within our community teams. And also we have our integrated neighborhood teams that are slowly developing now as well. So what is the next step for the EICT is to share our model, share our way of working with the other teams so that we all can then start working integrationally together. Is there another slide there? Sorry. Okay. What I wanted to do, or what I'll do, and Della had some stories of difference. This is where the team have gone out and worked with our citizen, and there has been really good outcomes for the citizens in the way that we have done our approach or our intervention with the citizen. I'm just going to bring up one of the stories. If we can just get this. Sorry, just bear with me 1 minute. Okay. I'll just do one of a story of difference from one of our case studies that was undertaken. This is a recent intervention by an integrated neighbourhood teams, which works alongside our early intervention team. A recent intervention by the integrated neighbourhood team in the north of the city of Birmingham. Given the INT team, they meet weekly, and using our triaging, any referrals that are made initially first triage within the team. This is where the team will go through the referral and to be able to identify which professional would be the best person to be working with the citizen and what plans could be put into place in order to get an early discharge. So they meet weekly and review the cases. I'm just looking at the start of this one. Sorry. The goal of the INT is to try and deliver a better joint-up health and social care service to provide same-day early intervention and urgent response care for those patients, especially those with more complex health and care needs. Mrs. S was one of such citizens who has anxiety and CPDO. She was presenting at our local emergency departments at least once a month and needing GP appointments at least almost twice a week. The neighbourhood expert, which the neighbourhood expert is one of the professionals within the team that has a very good understanding of all the resources within the locality or local area. So the neighbourhood expert was appointed as a caseworker and called Miss C to find out more about exactly what her needs were. What was quickly became apparent was that Mrs. C felt isolated and lonely. The neighbourhood expert suggested that New Heights in King's Standing could be a great starting point to try and ease some of the feelings of the loneliness. The New Heights project is a community centre that is home to many activities and includes, there is a cafe and a tea shop and counselling services that is within that building, and a lot of other activities take part in there. So Mrs. C.S. was invited to the New Heights project, and she was welcome, and she suggested the trip to go out there. The neighbourhood expert introduces Mrs. S to the project manager at the centre, who agreed that Miss S should have a visit just to spend the day and see what activities were available. In the last 8 weeks, Mrs. S has not presented at our emergency department, and she has only had 2 GP appointments, which were appropriately booked, not randomly her turning up. the neighborhood expert has gone back to the manager just to have a review and an update of how Mrs. S is progressing at the moment. And the manager from the New Out says that Mrs. S is taking part in a number of activities, and she has made a new friend. She's made a new friend, and it's been a great outcome for Mrs. S and also for the engagement of the neighborhood expert. Okay, that's what I have.
Thank you so much, Grace.
Sorry about that. I just had to grab the presentation.
Thank you ever so much for stepping in at the last minute. That was a real insight, and really appreciate it. Thank you. So for the last 10 minutes, I would like to go through some of the questions that we have in the chat. So the first one that I can see is quite a general question, and this is to the Birmingham team. And Nabilia asks, are there any plans to create elderly villages and in Birmingham? And if so, how will the needs of those who don't wish to be at the villages be accommodated? Perhaps those people that want to stay in their own home. So would somebody from the Birmingham team like to respond to that one?
I can answer. Becky?
Yes, sorry, Heather, I thought it was going to be to the other speakers. I guess if we interpret the village for the elderly as residential care, which is how I interpreted it, we do already have a number of residential care settings, some provided by the local authority, and Grayson, do come in if you want, and some by non-statutory services. But in terms of Grayson, any reflections on what the new development in Leipzig is and how that relates to us in Birmingham?
When I was talking about the homes in Leipzig, it sort of reminded me of Hadley Village or Bourneville Village, which are residential community homes. I'm not sure if you're aware of those.
I know Bourneville Village.
Yes, carry on.
That is the most similar sort of resource that I can match up with the Leipzig. And there are 3 homes, but I'm not sure if there's any plans to build any more. What I'm going to, but there are 3 similar type of projects that are across Birmingham.
Yeah.
Thank you, Becky and Grayson. So the next question is to Stefan. And the question is, do you plan to incorporate AI technology into your design for the village for the elderly? And if you are planning to incorporate that, could you give us some examples, please? And that was from Becky. So question to Stefan.
Ja, ich hatte meine 3 Fragen schon
I have had my question answered in the chat. Yes, we are planning this in certain areas. Also for the staffing levels, AI can be very good, but we are I'm not really able to give you any kind of examples at this moment in time because we'll be deciding that at a later stage.
Thank you, Stefan. And now I have a question for Mr. Eckner, and this is, has there been any consideration of implementing concepts like the one in the Netherlands, where villages for Alzheimer's patients are equipped with fake hairdressers and fake stores, etc.?
I'm not aware of any.
Also, Also es gibt, ich habe das also auch in Holland gesehen, ich habe das
I've
auch
seen that in the Netherlands and in Canada, where I was in Switzerland 2 weeks ago, and again, it's there where on site there is a shop where dementia patients can be taken to go shopping, and also in cafes, we are thinking about that, but how we exactly would do this, I don't know yet. It depends on the kind of facilities we have and integrate those. We don't have a fake hairdresser, but we have a real one.
Thank you, Mr. Eckner. And now I can see a question for Grayson. How do personal health budgets play a part in this? And will this be a smoother process to apply and receive? And will this be a smoother process to apply and receive this for individuals than is currently the case?
Personal budgets, which in health are called personal budget within social care is direct payments. The direct payments currently, to receive a direct payment, the process is quite smooth. I know initially when we started to do individual budgets, as it was called then, there was very much clumsy bureaucracy within the system. But currently now, once somebody has been assessed to have eligible needs, then that process for direct payments is promoted as part of our targeted offer. So yeah, I'm not sure in the sense of where we've had any kind of not being able to get direct payments, because it is part of our promotion within our model.
Thank you, Grayson.
Does that answer? Sorry, does that answer?
Does that answer the question? I think it does.
No, not really. Sorry.
Not...
It was my question to Grayson. Sorry, it's Nabila here from Ways for Wellbeing. It doesn't really, because I know several clients that we work with who have reported that it's not a smooth process, but I'm happy to pick this up outside of this meeting with you.
Happy to do that.
Because it's putting a lot of people off, especially those who are struggling with their mental health at the same time.
Okay, because usually when somebody has direct payment, there is a qualified worker that's normally allocated with the person to go through the paperwork and make the connections to the right departments. So there should be support when people are doing that process. But I'm happy to pick it up with you outside if there is problems.
Thank you. I realise we've only got 3 minutes left. So just a message to everybody, if you would like a copy of the presentation that we've been showing on screen today, then please could you email international@leipzig.de, and then we'll be able to share the presentation with you. And just to say that I'd like to give a huge thank you to our wonderful speakers, our politicians, the interpreters that have had a really difficult job too, and everybody working behind the scenes who've made this possible, and of course everyone that's attended today. So please look out for the email that will answer the questions that we've not had time to respond to in today's session. Alongside the answers to these questions, we will also be circulating an evaluation. So it would be wonderful if you could respond to that evaluation so that we can continue to improve these lunch and learns going forward. So just enjoy the rest of your day, and hope to see you another time. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, guys.
Goodbye.
Thank you for asking my questions.
Thank you.
Thank you.